Hello, it's Dr. Rhonda Johnson. Today is Wednesday, January 6, 2021, and it looks like the SARS-CoV-2 virus has upped its game, folks. And so I'm going to be talking about how we can up our game too. You know, this virus is just bad news. No matter how you look at it, it's just bad news. And what's ironic is that a virus is one of the most basic life forms that exist. It can't even exist without a host. But yet this lowly life form has totally turned our world around, infected 80 million people, and killed over 1.8 million people, and the number keeps climbing every single day. So we now have two major strains of a mutated virus, one that is coming out of the United Kingdom and one that has come out of South Africa. Experts have discovered that the one out of the United Kingdom is now in 30-some plus countries and is in 4 states here in the United States. Now, this virus is drastically more contagious, and it's spreading faster in communities across the world than the original virus strains. So public health experts, the ones that you see on television, say that this new strain will become the majority strain for all new infections by March 1st. It's going to spread rapidly. So I want to offer some common sense advice. Just assume that where you live, this super contagious virus is already present. And folks, you know what it does. It just waits for an opportunity when we let our guard down, and then it infects us. We don't know who has this virus, so just act like everybody has it. And the bottom line is we have to hunker down, we have to mask up, we have to do the best we can, and then get the vaccine when our turn comes in the line, because it appears this pandemic is far from over. And the magnitude of what this super contagious virus means to us is really worth understanding. Okay, so the experts that you see on TV say that this new virus strain does not make us sicker. Well, that's reassuring, because the virus is already making enough people so sick that our healthcare system is crumbling. The issue is, of course, if the virus spreads more easily, then it's going to infect more people, which means that more high-risk people will be in hospitalization. So this virus is super contagious virus is not going to flatten the curve. It's only going to fatten the curve. Now, another implication is that young people in many communities across the United States, young people are driving this pandemic. And it means that with this super contagious strain, that more and more of them are going to get sick also. In hospitals all across the United States, young people are sick. They're on ventilators and they're dying. Now, it's hard to lose anybody that you know, but it's especially hard to lose young people, because we like to think that they should be going to school, going to college, or pursuing their life dreams, or getting married, or having kids, or raising their families. And instead, they're dying in some hospital alone from COVID. Or if they survive, they're fighting to get their life back, to get their health or strength back. So this is a concern for us. And it also makes me very concerned about children, school children. You know, in the United States, in the United Kingdom, how they picked this virus up was they picked it up in school children, because so many of them were getting infected at school. And we already know that children get the infection, but most don't get very sick. But what happens is their teachers, their parents, their relatives, their grandparents, their coaches, they are the folks that are getting very sick. So, which brings me to the topic of the COVID-19 vaccine. Folks, particularly if you have children, please be thinking about getting that vaccine. Make your mind up and get the vaccine so that when your turn and the line comes available, you can be vaccinated. The vaccine will protect against this super contagious strain. So, remember, we have two ways to help in this pandemic: human behavior, and when the virus has upped its game to be more contagious, we have to up our game to be more prevention focused. We have to be extra diligent with our mask on, washing our hands, avoiding crowds, maintaining that extra physical space between you and someone else. Again, I know a lot of the infections are occurring in places where physical distancing is challenging, like in prisons and healthcare facilities and in long-term care facilities and in food processing plants and retail and public transportation. But do the best you can to minimize your risk of infection. And again, be planning to get the COVID-19 vaccine when it becomes available to you. And when at all possible, open up the windows, ventilate your places where you live, and avoid the 3 C's: contact with infected people, poorly ventilated or closed places, and crowded locations. I know we'll get to the other side of this pandemic, although January, February, and March are going to be tough with the numbers of sick and the numbers of folks who are dying. That's going to be tough. The SARS-CoV-2 virus has upped its game, and folks, we have to up ours. That's my message for today. This is Dr. Rhonda Johnson. My views are my own. Stay the course and have a blessed day.